Hello, and welcome to today's lecture on fluid and electrolytes. This lecture should be mostly a review. The part you'll need to concentrate on for Nursing 491 are the nursing interventions related to the different fluid and electrolyte imbalances. Please take a moment to familiarize yourself with the learning objectives for this video. Slides 3 through 7 help you with this review. Homeostasis is the goal to manage your fluid and electrolytes and acid-base imbalances and reestablish and maintain homeostasis. And here it talks about what homeostasis is. Again, this should be a review for you. Body fluid management is done with osmosis, diffusion, filtration, and active transport. Again, this should be a review. Please take the time to read it through it in the book. Fluid balance is closely linked and related to electrolyte concentrations, fluid intake, and fluid loss. Please remember that something you should have learned in previous classes is that the minimum urine amount needed to excrete toxic waste daily is between 400 and 600 milliliters per day. Insatiable water loss is through the skin, lungs, and stool. And these are the ways that our body regulates our fluid balance. Again, these are just reviews. So let's take a moment and look at table 13.2 on page 246. And it talks about the common causes of fluid imbalances. Dehydration, or not having enough fluid, can be from a hemorrhage, vomiting, diarrhea. It can be from profuse sweating, burns, GI suctioning, diabetes insipidus, impaired thirst. A lot of times people with fever will be dehydrated. So what you need to do is think about what are the disease processes that I've already learned about that can cause dehydration. Now, fluid overload. This is when the body has too much fluid. So what are some causes of it? It can be late stages of kidney failure, heart failure, which we're going to talk about in extent next week, long-term corticosteroid therapy, and water intoxication, and excessive fluid replacement. So these are some of the common causes of fluid imbalances. Remember, when circulating blood volume is decreased, it leads to reduced perfusion. Our body has defenses against decreasing perfusion, and that includes increasing vasoconstriction and peripheral resistance to maintain a patient's blood pressure and circulation for the body. So what will you see with respiratory system? You'll see increased respiratory rate. And the reason for that is to compensate for the lesser blood volume. It's in an attempt to maintain, it's a compensatory mechanism in an attempt to maintain oxygen delivery to the body. So you'll see an increase in a patient's respiratory rate when you have hypovolemia. So what skin changes do we expect to see with dehydration? They'll have poor turgor. They'll have dry mucous membranes. The tongue may have deep furrows due to the dehydration. Their skin may be dry and scaly if the dehydration has been over a great period of time. Neuro changes that are seen with dehydration are seen more often in older patients. And a lot of times you can see a decrease in their cognition. You'll see confusion. You'll see this a lot of times with patients who have urinary tract infections as well, causing that dehydration. Now, when you're looking at the kidneys with a patient with dehydration, remember your urine is going to be much more concentrated, more goldenrod in color, and will have a much higher specific gravity. So now what we're going to do is take time to look at best practices for safety and quality of caring for our patient with dehydration. The nursing interventions are laid out very nicely for you in the best practices for patients with safety and quality of care, the patient with dehydration, on page 248 in that table. But what are some of the things when you're thinking about it that you're going to need to do and take care of, and what nursing interventions are going to be required for our patient with dehydration? We're going to want to make sure that we are watching their fluid intake and output. We want to ensure that fluids are offered often and that we are assessing their intake and output much more often, probably every 2 hours. We want to make sure that we are providing the prescribed infusion therapy. We're going to want to monitor, because these patients are sometimes getting large amounts of fluid in short periods of time, we need to make sure that we are aware of any pre-existing comorbidities such as cardiac, pulmonary, or kidney problems. So you'll want to make sure that you're aware of those as you are giving the prescribed IV fluids. You're going to want to make sure that you're monitoring that intake and output. You're going to be wanting to monitor their vital signs. Here, it says that you would weigh the patient every 8 hours. I think that's a little excessive. I think that most of the time you're going to see daily weights. You're not really going to see weights more often than daily for an adult patient. We're going to be monitoring for signs of fluid overload. We're giving these patients a lot of fluid in a short period of time. So you're going to look for difficulty breathing. You're going to look for the presence of dependent edema. You're going to make sure that they're not having crackles in their lungs. And so these are some things that you're going to want to do. And of course, give the prescribed medications. If the reason for the dehydration was from nausea and vomiting, they may be getting antiemetics or antidiarrheals. If it is because of fever, they may be getting antipyretics. So we want to make sure that we're giving the medications required to care for this patient. But they're all listed very well and very nicely for you, your nursing interventions for the dehydrated patient here on page 48. I'm sorry I forgot to put it back to full screen, but the slide did not change, so I'm not going to redo that. Again, you're wanting to look at the nursing interventions on page 248 for dehydration. We're going to talk about fluid volume overload several times this semester. So for right now, I'm not going to say a whole lot about it. Things I am going to go ahead and bring up are a lot of times patients with fluid volume overload have underlying kidney or heart conditions such as heart failure. So with that being said, what are some of the things we can expect to see with these patients? The patient with fluid volume overload may very well have pitting edema. And anytime a patient has edema, it puts them at risk for skin breakdown. So you're going to want to make sure you're using pressure reducing and pressure relieving overlay mattresses and turning our patient every 2 hours and making sure that we are not pressing too much into their skin and have their extremities supported on pillows if necessary. You're going to want to make sure that the patient with edema doesn't have socks binding into their skin, or hospital bracelets a lot of times will also bind into their skin. If they did not come in with fluid volume overload and now have volume overload, you may see more of that. So you want to make sure that you're looking for anything that's binding to make sure that you can relieve that for this patient. Most patients with fluid volume overload are going to be on some type of diuretic. A lot of times that will be a loop diuretic. With that being said, you want to make sure that you are adequately monitoring their fluid and electrolyte balances, such as their sodium and potassium values. As we've stated before, weight is the best indicator of fluid gain or loss on a patient. You're also going to see with a patient who's taking diuretics increased urinary output and hopefully a decrease in that edema. We'll talk about this more in our heart failure lecture, but I want to make sure that you're aware that when you're weighing a patient who has fluid volume issues, what you want to do is make sure you're weighing them at the same time on the same scale every day with the exact same thing on, and make sure that you're zeroing the scales appropriately. Again, here is just a picture of what fluid volume excess looks like, and it goes over the key features of fluid overload listed for us on page 250. And we've already reviewed these earlier in the lecture. And here is just a list of good reminders and nursing interventions used both for fluid volume deficit and fluid volume overload. We're going to continue watching for their cardiovascular needs, their intake and output, their weights, their respiratory status, and we're going to be assessing for skin breakdown as well.